A big part of wanting to come back to Central Illinois was to be closer to family. So my wife is also from the Chicago suburbs, and she has some family down in the St. Louis area. So this is a really nice in-between area with both of our families. Yeah, I love family medicine. I think that's one of the biggest reasons is the relationships I can build with patients over time. It's so cool that we have, third and fourth generations of families even among our patients. I have actually gone from one room seeing a newborn baby to the next room seeing someone over 100 years old. So just the wide spectrum of life. And we can help with all aspects, including focusing on lifestyle changes and preventative health, addressing acute illnesses and injuries, managing chronic diseases like diabetes and high blood pressure, helping with mental health concerns like anxiety and depression. We do a lot of office-based procedures as well, so every day is very, very different. So some of the procedures that we provide here include skin biopsies and skin procedures. We do joint injections, different birth control implants, as far as, or among other things. I was always more inclined toward medicine. It just seemed like something I was interested in. I really enjoyed my science classes in school and things like that, but I don't have a outrageous origin story. I love running and reading, so I've ran in college. I was in cross country and track. I was a team captain for both cross country and track. That's actually where I met my wife, was in college. We both ran together. And then I love reading books, mostly going to used bookstores, a lot of fiction. So I have a little room in our house that's our library, which is kind of fun. I think one of the most unique aspects about our office is the fact that we are always constantly progressing. So we've changed office locations when Dr. Hill and I first joined to our current location. We've expanded within our building, and then along the way we've added lots of different other features, including on-site laboratory blood draws. We have on-site mental health services, nutrition, physical therapy, as well as the procedures I mentioned. We've expanded to a new electronic record, which is very cool. One of the most interesting aspects of that is the patient portal, which really helps, I think, our patients engage within their own care. They can see office notes that we write. They can send messages to us, which I think is one of the most fun aspects of that, because they can write me a message in their own words, I can write back in my own words, and we can respond to each other in real time. I think it does make me a better doctor to have the access that we have both here in the office as well as the hospital systems. So we can access both hospital electronic records remotely as well, which really can emphasize the care that someone gets in the hospital as well as what we can provide here in the office. We have a great relationship with the local hospitalists that see our patients in either hospital in town. And so we give patients a call when they're in the hospital, when they leave the hospital. We have them follow up very closely with us afterwards, and so we can help them with that transition period. So I do think patients who are using the portal do get a better experience because they can have more interaction with their provider remotely, as well as when they're in the office. They can see blood test results, they can see messages that we write. They can schedule appointments online and have a lot of that access at their fingertips. My patients that use the portal are able to respond to me, and I can respond to them in my own words. And there are times where I am sending a message back and forth to the same person multiple times in a day. Whereas if they were to call on a phone, that's probably not going to be able to happen in that short of a time period. So I think that's a way that they can get questions answered in a timely fashion, but also have that direct contact and not have to worry about the whole telephone phenomenon where someone's words are summarized and then my words are summarized. It's our direct language that we're contacting back and forth with. I think that's such a big deal because we don't want to miss the meaning of what someone's questions might be and the responses. So we want to try to minimize any confusion or misunderstandings in that way. I think it does result in better outcomes in the fact that answers can be provided in a more timely fashion, and the longer that someone's waiting or concerned about what's going on, the longer they may put that off without that easy access. I think the fastest way to get me to smile at work is the people. We just have a fantastic staff. Dr. Pilcher is just really a visionary in our field with the way he's built this practice from the ground up, literally. Dr. Hill and I were best friends in medical school, so I never thought I would be working with one of my best friends, which is just fantastic. Both of our nurse practitioners are absolute rock stars, which is cool. And all of our office staff, from the front desk to the nurses to the rooming techs to the medical assistants to our medical records and office management and lab person and everyone else are just top-notch. And so I think working in an environment where everyone enjoys each other, everyone has fun, really hopefully comes across in the patient experience.